Hi, my name is Ishaq and I'm the consultant CIO working on hospitals. I represent Health Information Management System Society, in short called HIMSS, which is a US-based not-for-profit body, as the secretary for APAC India chapter. Yeah, electronic medical records adoption, especially here in India, has been facing its own challenges. We all are aware of. In general, as we know, healthcare has been lagging behind other industry segments, like for example retail to banking, by quite a lot of number of years. And at the same time, healthcare is also, it's a real good news that it is catching up to the current trends of, be it machine learning or artificial intelligence. So it's a long way to go as far as the overall digitization and overall systems implementation, especially on the clinical side, is concerned. So just to take a few examples, some of the hospitals in India, if you have gone through recently, you would encounter, when it comes to the operational side of it, whether it is billing or whether it is looking at the services and all that, a lot of computerization you will see. But when it comes to your own medical record, I mean, majority of the times it is written on paper, and maybe at the best end of the whole hospitalization, you may be given a digital discharge summary. What it talks about is that, yes, in hospitals, if you know, there are primarily two different segments. One is the operational and the other is the clinical side. Operational has been using systems for quite some time now, but the clinical side has been lagging behind. What are the fundamental reasons why this has been happening? If you talk to doctors, Dr. So-and-so, why are you not using the system? He would give 2 to 3 reasons for that. Number one, he will say, first of all, I'm like 50 plus, and when I was studying in my college, the subject was never there, and you suddenly bring in something, and it is not very user friendly. So the first aspect is about the usability of the solutions. Some of them are a bit difficult to comprehend and use. That's the first thing that is thrown. That is the reason given from the doctor's side. The second aspect, which according to them, and in a lot of cases we have seen it to be true as well, there is a gap between what the technology is offering or can offer and what the clinicians are looking forward to. And how do we bridge that gap, and what are the ways that one can bring about that change, and so that the doctors start using it. Having said this, the story is not so bleak in all of the areas. There's a lot of work happening. There's a lot of enthusiasm, especially from the young crowd, or the young doctors who are graduating from colleges. They are very much ready. They are demanding. They are reading a lot on the internet. They are catching up with the latest trends happening, and hence there is a new environment or momentum that is gathering up in terms of technology adoption in various hospitals. Having said that, one of my roles, the one where I played as a group CIO of Kerala Institute of Medical Sciences, just to put on record, okay, we have implemented EMR in both outpatient and inpatient quite successfully, and it is as a case study available for anyone who would want to go and visit and look at it. So in a nutshell, yes, we have a lot of work to do and catch up on the latest technologies. At the same time, there's a lot of work happening, and the CIOs are not turning any stone unturned in terms of making it happen. Yeah, that's a very important question, because when we talk to doctors, they are always looking forward to solutions which will ease their work, something which will de-risk the kind of work that they are doing, something which will save their time, something which is good for the patient in an overall sense, in terms of reducing the medication errors, to looking at, so they are quite excited. They're looking at what a CDS can offer, especially when it comes to the new viruses that are coming up, the new diseases which are coming out there. And look at this example of a doctor who's working in a tertiary care setup, and for him to kind of diagnose something which just came out yesterday, it's going to be really tough. And going through the journals and referring them and all, who's got the time? So in a nutshell, it saves the time for them, and the information which is very critical is on the fingertips, and this is like life-saving as compared to any other productivity measures where you would be looking at saving some money, but here it is saving lives. So that's the efficacy of having a CDSS, wherein it improves the clinical efficiencies and it can better the outcomes as well. Yeah, that's a very important question, wherein the CDSs, traditionally, even the solutions which are out there, they have also gone through a process, and they have also have their own evolution. Initially, it started with online reference. Okay, there was just a reference which is available online, which means that whatever solution that the doctor is using, he will have to temporarily step out. Okay, maybe open a browser and go through it. There have been the Medscapes of the world and the UpToDates of the world. Okay, they have been available there. One of the challenge with that, actually a couple of those challenges, as I said, one has to move out of the system, number one. Two, okay, the work that this man was doing or the lady was doing, it has to be again correlated there. So you'll have to search the appropriate one and then bring it to the context. An integration of an EMR with the clinical decision support systems or the journal and the material and the clinical information itself along with the EMR saves a lot of time. It is very contextualized, and hence it is going to be more effective, and this may actually lead to better utilization of the system, the usage of the system as well.